Welcome back to Your Health Matters. I'm Peggy Pico. It was just a couple of years ago that Jenny Weber was finally ready to retire and enjoy life to the fullest. As an avid traveler and overall lover of life, she was ready for anything, but what she got was unexpected.
About 2 years ago, I just hit a wall. I mean, just everything stopped. I started feeling a horrible pain in my hip, and I thought for sure it would go away. I could just work through it, do more exercise, do more walking. It would get better. And I tried lots of things, acupuncture and chiropractic work and pain meds and no pain meds and all, everything I could think of, believing that surely I could fix this because I'd never ever had anything wrong with my body ever.
It turned out that Jenny's hip was in really bad shape. Life's wear and tear had taken its toll and left her with severe pain that would most likely have to be managed with pain medicine for the rest of her life. Or she could get her hip replaced, a prospect that frightened Jenny at first.
My sweet mom at 80 went into the hospital to have her hip replaced, and she did not come out alive. The hip replacement actually was perfect, but she had complications in the hospital, and before she went in, she said, all my friends tell me that it's not good to get a hip replacement, and I thought, oh no.
But to Jenny's relief, her doctor assured her that today's technologies are much more effective and far less intrusive than previous hip replacement surgery.
Well, the traditional hip replacement incision was quite long, extended in the back of the hip, requiring detachment of quite a lot of the muscles in the back portion of the hip. Minimally invasive hip replacement surgery is surgery that is done through limited incisions with less soft tissue trauma than the historically used big, long incisions for hip replacement. Those incisions used up to maybe even 5 to 10 years ago were sometimes 12 to 15 inches long, extending from the upper part of your rear end halfway down your thigh. Now we're using incisions as small as 3 or 4 inches and not cutting any tendons or muscles, and people recover quite a bit sooner.
The new technology is even fun for the doctors.
These developments of new prostheses it's been exciting. Some new materials, we don't use bone cement anymore, space-age materials where the bone grows into the metal, locking it in place. These are all very exciting developments.
For Jenny, that was very important. With her active lifestyle, she didn't have any time to waste. And fortunately for her, she was an excellent candidate for this type of surgery.
She was absolutely the perfect candidate. Slender, didn't have a severely deformed hip, just had bone-on-bone severe arthritis, and was an excellent candidate. She is just an active person and likes to dance and have an active social life, and she was not willing to live with her painful arthritic hips.
Once Jenny had all the facts, she was ready for the surgery.
I made the decision I would like to have the surgery, and I said I'd like to have it today if you're available. And he said, well, not today, but I think we could do it soon.
And now?
Well, now I'm just zooming around. Now I'm good. I have no pain meds at all, and I just started walking right away, and I'm just walking faster and farther. I'm doing Pilates twice a week. I do aerobics 3 times a week. I'm hiking, planning a big trip to the Grand Canyon with a backpack, and there's no problem. It's great, and it's wonderful. I mean, when you feel the difference of being so depressed and not being able to move and not being able to do really simple things, to being able to have your life back and just zoom all around, it's great. So I'm thrilled.
Now, minimally invasive surgery was fantastic for Jenny. It worked out for her. But are there some patients that will still need to require the more traditional hip surgery?
Well, the ideal candidate is a patient like her. She was slim, she was in good shape. The heavier you are, the more difficult this kind of surgery is because it obscures your visibility. So She was the ideal person for this kind of operation.
What about age, race, gender? Do any of those things matter when it comes to doing a minimally invasive hip surgery?
Those wouldn't influence the type of surgery you would choose, no.
Okay. And when it comes to minimally invasive, we heard a little bit about, that they're not cutting the tendons or the incisions. Why is it better? I mean, is the risk less? What makes it better than a more traditional?
What we see with all of the surgeries that are less invasive, or what are now called minimally invasive surgeries, the less disruption you have of muscle and other tissue, the quicker you heal, the less complications, the less chance for infection, and the less pain you have. So you're back on your feet, back doing what you want to do faster, the less invasive the surgery.
So all of the difference between the foot-long surgery and the incision and the 3-inch incision can make a difference in your healing time?
Very much so. Much less tissue disruption, so you heal faster. And the less pain you have, the more likely you are to start going about your normal activities more quickly.
And that's important for recovery as well, the rehab with hip surgery?
Absolutely.
Okay.
The faster patients can get moving, the faster they can begin their rehab.
All right, well, just one of the many, many things going on over at Eden Medical Center with sort of these new technologies. So when we come back, we will learn about a revolutionary new tool that is helping out in the OR.